Good morning. I'm Dr. Karthikeyan, Consultant Intervention Neurologist, Apollo Hospital, OMR. World Stroke Day happens on October 29 every year. The reason for having such a campaign on stroke, because stroke is a very devastating disease. The last year campaign, which shows 1 in 4 individual is being affected by stroke after the age of 25, which affects male and female in an equal proportionate. So such a high numbers have been expected in the upcoming years, and right now we are staying in a stage of COVID, which has further enhanced the risk of stroke, because post COVID there is an increase in tendency to clot inside your blood vessels. So there is a high risk of stroke. For a common person to understand, stroke means paralysis. That's like suddenly your hand and leg doesn't move, or he cannot speak, or sudden loss of vision. So if anybody is being affected by the stroke, please visit a nearest stroke center. So previous era, the stroke is not a curable disease. In a present era, definitely stroke is a curable as well as a preventable disease. So we have when the person is affected by a stroke due to a blood clot, immediately we give a medicines through injections, which can be given in 4 hours, or we remove the clot inside your brain, just like how we do an angio for your heart, we do it for the brain, and we remove the clot. So this can be done till 24 hours. So the relatives of the patient, if they recognize the symptoms, get them to a nearest stroke center as early as possible. Why I am stressing the word as early as possible? Because every minute, every second, so much of millions of neurons are lost, and these cannot be regained once the blood flow it's been stopped permanently. So you have to act as fast as possible. So just remember, your brain is like the most expensive computer you ever had, and it stores millions of informations which is being developed over the millions of years. So these can be lost within a minute. So just recognize these symptoms, like if they can't move their hand and leg, or if they can't see, or they can't speak. So once they have the symptoms, just come to a nearest stroke center as early as possible. So stroke is not only a preventable disease. How do you prevent it? Always have your blood sugar checked, your blood pressure in control, avoid smoking, quit alcohol, have a good sleep hygiene, regular exercise. This will help preventing stroke. And if you recognize people having stroke symptoms, get to a stroke center as early as possible. Stroke is now a curable disease. Thank you.